right side. The right side receives oxygen-poor blood from the body and pumps it to where? The lungs. The left side receives oxygen-rich blood from the lungs and pumps it to where? The body. And that's respectively called the pulmonary and the systemic circuits. So let's go through some of the structures externally first, and then we'll go through the internals. So here we have what? Superior vena cava and inferior vena cava, coming from the lower part of the body, coming from the upper part of the body. Empties into this chamber, which is the right atrium. An atrium is a receiving chamber. So this is oxygen-poor blood. That blood is pumped from the atrium into the right ventricle through this valve. The valve is in between the right atrium and right ventricle, so we call it the
Atrioventricular valve.
right atrioventricular valve. It's also known as the tricuspid. Remember, you're going to try before you buy. Okay? So it goes into the right ventricle. Now, these valves are anchored by these cords of tendon. I don't think I mentioned that, by the way. These cords of tendon. So these are the corda tendineae, otherwise known as tendon cords, and they are attached to these little finger-like muscles. And those finger-like muscles here are called papillary muscles. See, I'm giving you the finger, all right? Right there. That prevents the valves from opening backwards and allowing blood to flow backwards. Okay? Good so far? All right. From the right ventricle, we go through this valve, which is at the base of the pulmonary trunk. What do we call that valve? This is the, you're jumping ahead of us. You're already in the left ventricle, okay? Okay, typical women. Slow down, step at a time, all right? Be patient. Okay. You're already in the left ventricle. This is at the base of the pulmonary trunk. So we call that the pulmonary valve, all right? Those two reasons. Now, this is the pulmonary trunk, gives rise to the left and right pulmonary arteries. True or false? All arteries carry blood away from the heart. We have true over here, we have false over here. All arteries carry blood away. Arteries begin with A, they carry blood away. Okay. So, second question, true or false? All arteries carry oxygen-rich blood. That's false. So what's the exception? The pulmonary artery is the exception. The pulmonary artery carries oxygen-poor blood from the right side of the heart into the lungs. We drop off the carbon dioxide, we pick up the oxygen, and we bring it back into the left side of the heart, which is the left atrium, via these blood vessels called the pulmonary veins. So, true or false? All veins return blood to the heart. True. What is it? True. With confidence. True. All right. True or false? All veins carry oxygen-poor blood. False. That's false. What's the exception? Pulmonary veins coming from the lungs carry oxygen-rich blood back to the heart. Into the left atrium. From the left atrium, blood gets pumped through this valve. Now, that's the bicuspid, also known as the mitral, also known as the left AV valve or left atrioventricular valve. All right, and then that goes into the big chamber, which is the ventricle, left ventricle, up through this valve, which is kind of tough to see. All right, so I'm going to push this valve here. See the valve at the base of the aorta? Base of the aorta. What's it called? If this is the pulmonary valve at the base of the pulmonary trunk, what's the valve at the base of the aorta?
Aortic valve?
How about the aortic valve? Okay? Got it? That's the aortic valve. So it goes up through the aortic valve, through the ascending aorta, through the aortic arch, and then now through the descending aorta. Now once the descending aorta goes through the abdomen, we now call it not the descending aorta, but we call it the abdominal aorta. It's all the same blood vessel. At the very top of the arch, you've got three blood vessels. The one on the left is called the left subclavian. It goes underneath the clavicle. Then it becomes the axillary artery, then the brachial artery, then the radial, then the ulnar, palmar artery, digital artery. Okay? That's kind of basic. On the way back, digital veins, palmar veins, radial, ulnar, brachial, subclavian veins. So the nice thing about arteries is they take the same names. Arteries and veins travel in pairs, they usually take the same name. Okay? Now this one in the middle is called the common carotid, also called the left common carotid. And the reason it's called the common carotid because it branches off into an internal going into the brain through what opening? Carotid foramen or carotid canal. And then it also branches off into an external blood vessel which goes up through the temporal portion of the body, and you can actually feel it pulsing right here, especially when you have a headache. That's a branch off the carotid. Now, the jugular is coming back through what foramen? Jugular foramen, okay? And again, all these things are coming back to haunt you. It should be getting, hopefully, it should be getting a little bit more familiar to you. Now, when blood enters the right atrium, it is coming from the body. It's oxygen poor. It's either from the superior or inferior vena cava, correct? What part of the circulation has just ended? What do we call that? What part of the circulation ends at the right, pulmonary or systemic? Pulmonary begins at the right atrium, the systemic ends. So the systemic ends when the inferior vena cava, superior vena cava empty into the right atrium. Now we begin the pulmonary circulation, which means we're going to go where? To the lungs, and we're going to drop off the oxygen poor blood, or oxygen poor carbon dioxide, and we're going to make it oxygen rich and pick up the oxygen, okay? So now we've got the pulmonary circulation through the valves, through the ventricle, through the valves, through the pulmonary arteries, into the lungs, to the capillaries, drop off the carbon dioxide, pick up the oxygen. We come back via the pulmonary what? What are these called? Pulmonary what? Veins into the left what? Atrium. So at the left atrium, what circulation ends? Pulmonary. What begins? Systemic. Okay? I've been saying that a dozen times tonight, I think. So make sure you know that. So now the pulmonary circulation ends and the systemic circulation begins through the valve, through the ventricle, through the aortic valve, up through the aorta to all parts of the body. Now, a couple of structures here externally that I don't think I've mentioned yet. I can't remember if I did or not. There is a depression in the anterior portion of the heart, which is called the anterior interventricular sulcus. It means it's in between what? Interventricular. In between the ventricles, okay? So it's in between the right ventricle and the left ventricle. So essentially the sulcus or depression has two functions. It separates the right and the left ventricle externally. It also houses the pulmonary artery and vein. There's another sulcus